Welcome to a fertility center in Germany. For most people, their own children mean the fulfillment of their lives, but more and more couples are unable to conceive. At the same time, it is not necessary to accept the unfulfilled child wish as destiny. We founded this German clinic more than 10 years ago. The following film should give you a better understanding of possible problems. We will present to you some treatment options. Which therapy path you finally choose depends naturally on your individual discretion. Besides, it is important to recognize the causes in order to make the selected treatment possible. The causes of inability to conceive can be divided equally between men and women. In Germany alone, around 2 million couples are infertile. In 2002, around 40,000 children were born after the IVF and the ICSI treatment in Germany.
With the ejaculation, 200 to 300 million sperms are discharged in a vagina, and immediately the first sperm cell begins their journey. During their passage through the uterocervical canal, they travel in queues so that they can survive throughout the day. Only the fastest and the most persistent sperm cell are capable of leaving the queue and of entering the fallopian tube through the uterus cavity. The movement of cells begins faster and faster while they prepare for fertilization. At this point of time, the ovulation takes place. The femoral ends of the fallopian tube takes up the egg cell. The egg cells are protected through a protective sheath. In order to fertilize the egg cells, around 1 lakh sperms must be active. The sperms discharge special substances that dissolve the sheath of the egg cells. Now the sperms can penetrate the egg cell. As soon as the winner sperm enters the egg cell, the structure of the egg cell membrane changes and all the remaining sperm are resisted. This sperm brings within the father's genetic material, and this meets the mother's genetic material in the egg cell. The whole fusion process is called the fertilization. In this process, they merge with each other and a new life originates.
There can be various reasons that prevent the occurrence of a natural pregnancy. These include hormonal disturbances, for example, increase in the male hormone, etc., that harm the natural female hormone production. Functional disturbances of the ovary are often seen and can be diagnosed in 1/3 of all women who are unable to conceive. There may not always be a complete fallopian tube blockage before regular transport of egg cells and semen cells is prevented. In fact, your smaller deformities or abnormalities are enough to slow down the regular transport of egg cells. In the worst case, a pregnancy cannot take place through a fallopian tube.
In half of the couples unable to conceive, the main problem is in the male. Therefore, the analysis of sperms in the beginning of the diagnosis is important. In this area, we provide computer-supported analysis procedures that make an objective examination of sperm movement possible. Sometimes it is found that there are no sperms in the ejaculation. In such cases, we undertake a small operative procedure which is called TESE. Under local anesthesia, a small cut is made over the testes, and during the operation, it can be ascertained whether sperms are contained or not. If they do, they are immediately deep frozen at 195 degrees and can be then used for artificial insemination or IVF or ICSI.
In vitro fertilization, also called IVF, one goes a step further. In this method, the egg cells and semen cells combine outside the body of the woman. This form of treatment is followed especially in the women whose fallopian tubes are irreversibly closed or are not present, or when the semen quality of the man is clearly reduced. After previous hormone stimulation, many egg cells ripen. On the day of the ovulation, they are carefully sucked out with the help of an ultrasound machine and a fine hollow needle. This process is called follicular puncture or egg retrieval. The procedure lasts in most cases not more than an hour and 15 minutes. Finally, the patient remains in the fertility center for a short rest period. Meanwhile, the egg cells are counted under a microscope in the IVF laboratory and are then transferred in an already prepared Petri dish. The egg cells with a protective sheath are then transformed through the suck-in and suck-out of the pipette, rinsed and washed. Then, the egg cells are put in a double-marked Petri dish. This is provided with name, birth dates and color code. Through this principle, the interchange chances are eliminated. In order to imitate natural situation for the egg cells, they are stored in a ventilator for 3 to 4 hours. Parallel to follicular puncture or egg retrieval, the semen of the man that is obtained a short while ago is prepared. Here too, through the same principle of double marking, the color code of the reaction glass and the Petri dish is identifiable. For the actual IVF procedure, the sperm cells are now taken in a pipette where they are finally brought together with the egg cells in the culture dish. After this, the culture dish remains in the Brotschrank for 2 to 3 days. During this time, the sperms enter the egg cells. Both merge with each other and the first division takes place. Before the male genotype combines with the female genotype, speaking from this stage of the process, according to German law, it does not count as life. Therefore, only a maximum of 3 fertilized egg cells grow further and the others can be inserted if wished. 2 to 3 days later, the embryos have reached the 4 to 8 cell stage and the embryo transfer takes place. With a soft container, 1 to 3 embryos are implanted in the uterus cavity. This process must be carried out carefully with the finger points because it largely contributes to the success of an IVF treatment. The complete process takes only a few minutes and is painless. On this day, rest and relaxation are recommended for the woman. In the following days, the imprint of the embryo should appear in the uterus cavity. In fact, the first dependable pregnancy test can be carried out only 2 weeks after the embryo transfer. Through a blood test, the quantity of the pregnancy hormone HCG can be ascertained. The intracytoplasmic sperm injection or ICSI is used when the fertilization is not possible through IVF. In this method, a single semen cell is injected direct in an egg cell with a micropipette. This process makes sense when the sperms cannot enter the egg cells without help. In carrying out of the treatment as against IVF, nothing changes in the man and the woman. As in the IVF, the egg cells are then washed. As differentiated from IVF, the surrounding protective cell membrane is freed with the help of an intensive sucking in and sucking out of the pipette. Finally, the egg cells enter the Brotschrank for 2 to 3 hours. Meanwhile, the sperms are prepared. Because the sperms swim very fast, they are slowed down in a media. Now, the choice of a suitable sperm is made. The tail of this sperm is lightly broken off with a pointed glass needle to reduce its movement. Now, the injection of the sperm directly in the egg cell takes place. The egg cell is not damaged in the process. In this way, all matured egg cells are treated. Finally, the egg cells are cultivated till the next morning and are then examined for fertilization. Ideally, 1 or 2 have built a male and a female part. If the couple wishes, the remaining egg cells can be frozen in the process stage. The deep freeze is successful at a temperature of -196 degrees in liquid material only with the fertilized egg cells. In such a way, they can be stored unchanged for many years. Circa 2/3 of such frozen egg cells are later usable and can develop into embryos. This process is called cryoconservation and it saves the woman from undergoing a renewed intensive hormone treatment and egg cell implant. The costs of cryoconservation and final embryo transfer are not reimbursed from the medical insurance.
In the realms of the IVF and ICSI treatment, hormone stimulation plays an important role. Our philosophy is with lesser hormone stimulation as far as possible. The side effects are less and the egg cell quality is better. We do this through a better selection of egg cells, and through this a higher pregnancy rate is guaranteed.